Welcome back to the deep dive. We often talk about mental health, but sometimes experiences seem to form a pattern, something maybe diagnosable.
hmm
And understanding that pattern can be the first step towards getting help, right?
Absolutely. When symptoms create that clear picture, diagnosis and then treatment become possible. It's really crucial.
So today we're doing a deep dive specifically into bipolar disorder.
Yes, exactly. Bipolar disorder. Our main source mentions it under psychological disorders, Cackrell, Lone, Tom, Lai, starting around page 34.
Okay, bipolar disorder. I think most people associate it with mood swings, but maybe extreme ones. What's
Yeah.
the core idea?
That's really the heart of it.
Yeah.
Extreme mood swings. We're not talking about just having a good day or a bad day.
Right.
It involves distinct periods, episodes of intense highs called mania, or a milder form, hypomania, and then really deep lows, which are depressive episodes.
So these highs and lows alternate.
Yes, the cyclical nature is key. There's a pattern to it.
Okay, let's unpack the highs first. Mania or hypomania. What does that actually look like, feel like?
Well, during a manic or hypomanic phase, you'd see a really elevated mood, lots of energy, like a lot.
More than usual energy.
Way more. Sometimes to the point where they need very little sleep but still feel totally wired. Thoughts might race.
Racing thoughts, like thinking really fast.
Yeah, and sometimes jumping quickly from one idea to the next. It can be hard to follow their train of thought sometimes. They might talk a lot more, much faster too.
It almost sounds, well, productive. High energy, fast thinking.
On the surface, maybe,
Mm-hmm.
but there's definitely a downside. That intense energy and racing mind can lead to uh, impulsivity.
Impulsivity, like what?
Like making rash decisions they wouldn't normally make, big spending sprees,
Hmm.
risky behaviors, things like that. And the sleep thing, needing significantly less sleep, that's a big clue. It's not just feeling good.
Gotcha. Okay, so that's the high end. What about the flip side? The depressive
It's
phases.
pretty much the polar opposite, a persistent low mood, feeling really down or hopeless.
More than just sadness.
Oh, definitely. Often there's a complete loss of interest or pleasure in things they used to enjoy. Hobbies, activities, even seeing friends.
Hmm.
You might see big changes in appetite, eating much more or much less. Same with sleep. Either can't sleep or sleeping way too much.
And energy levels.
Usually profound fatigue. Just feeling exhausted, drained, with no energy to do much of anything. It's a real struggle to function.
So these aren't just fleeting moods. They're distinct, sustained periods of these very different states.
Exactly. Distinct episodes. They have a beginning, a middle, and an end. And the fact that they recur, that they cycle, that's fundamental to bipolar disorder.
You mentioned the source material, how it categorizes bipolar disorder under psychological disorders on page 34. Does it give much context around that?
Yeah, it places it within that broader framework. It doesn't just list bipolar disorder in isolation. It covers a range of conditions.
So it's presented as one type of psychological disorder among others?
Right. It helps show that it's part of a larger spectrum of mental health challenges, not some completely separate, unique thing. Seeing it alongside other disorders helps contextualize it.
That makes sense. Okay, so given these patterns, these cycles of highs and lows, how does someone actually get diagnosed? What's the process?
Well, a mental health professional needs to identify that clear pattern of manic or hypomanic episodes and depressive episodes.
So they look for the history.
Exactly. A thorough assessment. They'll ask about the frequency of the mood swings, how intense they get, how long these episodes usually last, weeks, months,
Right.
and crucially, how much these mood shifts impact the person's life, their work, relationships, just day-to-day functioning.
I imagine it could sometimes be confused with other things. Are there conditions with similar symptoms?
Oh, absolutely. Differential diagnosis is super important, ruling out other possibilities.
Like what, for instance?
Well, sometimes severe depression on its own might be considered, or certain anxiety disorders might have overlapping features. Even things like substance use or other medical conditions need to be ruled out because they can sometimes mimic mood symptoms.
So it's a careful process.
Very careful. It involves looking at the whole picture, the specific nature of the episodes, the history, the impact. Getting collateral information, maybe from family, can sometimes be helpful too.
Okay, so let's say the diagnosis is confirmed. What comes next? Treatment. The source mentions therapeutic treatments, Cac-Lifu Fapitriello-Anash, from page 110 onwards. What does that tell us about treating bipolar disorder?
That section covers treatment approaches more broadly. For bipolar disorder specifically, treatment usually involves a combination of approaches. Two main pillars are medication and psychotherapy.
Right. Medication first, the source mentions pharmacological treatment, Lufap on pages 142 to 143. What kind of medications are typically used?
For bipolar disorder, the cornerstone is often mood stabilizers.
Mood stabilizers.
Yeah.
Makes sense. What do they actually do?
Their main job is to help regulate those extreme mood swings, to kind of level things out. They aim to reduce the intensity and how often the manic and depressive episodes happen.
So it's less about just stopping a high or lifting a low right now and more about long-term balance.
Exactly. Creating more stability over time, preventing those extreme peaks and valleys, helping someone stay more in a middle ground, emotionally speaking.
Okay. And then there's psychotherapy, Li. How does talk therapy fit in?
Therapy is incredibly important too. While medication helps manage the biological side, therapy helps with everything else, coping skills, understanding the illness, managing stress, dealing with the impact on life and relationships.
Are there specific types of therapy that are particularly helpful, maybe mentioned in the source?
Yes, the source brings up cognitive behavioral therapy, CBT, on pages 126 to 129. CBT is very commonly used.
How does CBT help with bipolar disorder?
It helps people identify unhelpful thought patterns and behaviors that might contribute to or worsen mood episodes. It teaches practical skills for managing stress, recognizing early warning signs of an oncoming episode, and developing better coping strategies.
So tools for managing the day-to-day and maybe preventing relapse?
Precisely. It's very skills-focused.
Any other therapies mentioned?
Family therapy lias fap geodine is noted on pages 134-135. This can be really beneficial
Why family therapy specifically?
because bipolar disorder doesn't just affect the individual, it significantly impacts the whole family system. Family therapy helps everyone understand the illness better, improve communication, and figure out how to support each other effectively. It can reduce stress for everyone involved.
That sounds like a really holistic approach, medication and therapy.
Definitely. It's almost always a combination. Rarely just one or the other provides the best outcome. And the specific plan, which meds, which therapies, is tailored to the individual.
Right, it has to be personalized.
Exactly. Based on their specific symptoms, severity, life situation, preferences. It's a partnership between the person and their treatment team.
And what's the ultimate goal? What are we aiming for with this combined treatment?
The main goal is symptom management. Absolutely. Reducing the frequency and severity of mood episodes. But beyond that, it's about improving overall quality of life. Meaning helping the person function better day to day, maintain relationships, succeed at work or school, pursue interests, essentially live a full and meaningful life despite the challenges of the disorder. Preventing relapse is also a huge part of it.
Okay, so let's quickly recap. We looked at bipolar disorder, defined by these significant cyclical mood episodes, mania or hypermania, and depression.
Right.
We saw how it fits into the broader category of psychological disorders. Diagnosis involves recognizing these specific patterns and ruling out other causes.
Careful assessment.
And treatment is usually a combined approach. Mood-stabilizing medication working alongside psychotherapy like CBT or family therapy to manage symptoms and improve overall functioning.
You've got it. And I think maybe the most important takeaway here is that bipolar disorder is treatable.
That's crucial.
It really is. For people living with it, for their families, knowing that effective management is possible offers real hope. It's absolutely achievable to manage symptoms well and lead a fulfilling life with the right support.
That's a powerful message. And it underscores, the importance of not just learning about this stuff, but actually seeking professional help if you recognize these kinds of struggles in yourself or someone you care about.
Couldn't agree more. Reaching out is the key step.
Definitely encourages continued learning and seeking support when needed. Thanks, it's been really illuminating.